You know what? I use a number of tools when I'm cleaning teeth and when I'm evaluating the health of the gums. And
Yeah.
these different tools right here are called scalers, and they have little sharp edges on them. We use that to remove plaque and tartar off teeth. And then we have some other little measuring rods here. They're called a periodontal probe, and we check your bone health with that. These right here are called explorers, and Dr. Hopewell uses these to check for soft spots in the teeth. Well, this device here, this is a monitor that is attached to our wireless intraoral camera. And the nice thing about this is if someone breaks a tooth or a crown has fallen off or they have a growth in their mouth and we want to show them what it looks like, instead of just handing them a hand mirror, we can actually use this camera, put it in their mouth, and take a picture of teeth. It's easy because in 1 second we can take a picture, and then we can use it to download into their computer file or to send it to insurance companies. But the nice thing about all this high-tech equipment is it's all seamless. It all works together. They can send it home, and then we can blow up the picture and show the person that they've got a lot of coffee stains or red wine stains, and maybe how a bleaching treatment might be recommended for them. We have had just the wonderful opportunity of getting a Velscope cancer screening device. This device we've been trained to use by shining this little light. We push this button, and when we shine this light inside of someone's mouth and we look through it, things that are abnormal growths in the mouth, things that could be precancerous, will show up a different color through here when we hit the light. And we try to screen people like once a year, or if someone's high risk, we know they're a heavy smoker, maybe there's a growth in there that when we look at them visually it looks kind of funny and we want a better look through here. And this is a screening device that we can use to send people, refer them out to the oral surgeon to have biopsies. But, you know, there's so many cases of oral cancer now, and a lot of them are not even related to smoking. So we've tried to incorporate this into most of our new patient exams, as well as patients that are more high risk. Well, we still use this, but we use it at a much lower setting now, since we're just activating the digital computerized sensor in the new digitized x-rays.
What have we got here?
This device is called a Diagnodent, and it is a laser that detects soft spots in the teeth, and we can use this on the chewing surfaces of natural teeth that don't already have fillings in them. And depending on what the laser beam bounces off of, it uses like a light ray, we can tell if there's a soft spot and get a cavity while it's still small.
Oh, gee, is that right?
Yeah, and it's been wonderful because we can do small little fillings instead of waiting till it's really big. And it's been wonderful to check children's teeth after their sealants have worn off, as well as people's teeth that when the doctor uses the Explorer to kind of poke into the grooves, it feels hard, but it might look kind of funny, and we can put the laser over it and it'll pick up if there's a cavity in a small groove that we can't poke into.
Gee, that is something else. This is a rather large piece of equipment. What have we got here?
It is. It kind of looks like a spaceship or something that looks kind of intimidating, but actually this is called a Panellipse X-ray machine. And in this device, we check for people's wisdom teeth, or people that are having jaw problems, or people that are being fitted for dentures. And it is a big x-ray machine that spins around your head. It is also digital. It uses less radiation than the older models. And it gives us a really good picture of the entire jaw joints, as well as the maxilla and the mandible and all the teeth in one view, one giant picture that's kind of a panoramic shape.
Wow.
This device is called a Cavitron Ultrasonic Scaler, and the nice thing about this is that it uses vibrational energy plus water to remove buildup off your teeth, and a lot of people find this more comfortable than actually hand scraping with the scalers with the little blades. And it takes the power and the energy of the electricity that goes through here, and it forms these vibrations that are 30,000 times a minute. And the vibrations are what remove the plaque and the tartar and the stains off teeth, much like an ultrasonic jewelry cleaner.
No, I was going to say it sounded like,
Yeah, it takes small particles off. And the nice thing about this device is that it has a little reservoir here that we can put baking soda in, and we can actually use the baking soda to remove stains off of grooves in the teeth that you couldn't get off with the regular polishing paste and the little rotary polisher.
So what do? You pick up the powder with that? How did that work?
We pour a baking soda, a specialized baking soda powder into the reservoir here, and then we can use this device to actually like power wash the teeth. You can spray it onto the teeth and it removes stains rather quickly.
Oh, does it come through that?
It comes through this.
Oh,
We have another like another attachment that goes on here. This one's to remove the tartar and the plaque, and then the other attachment that we have that goes in here is what the baking soda slurry comes shooting out of, and you can actually just swoosh it around the teeth and it removes stains rather quickly.
Oh, gee, that's just amazing. Interesting. This has been an interesting visit.
Well, thanks for coming in, John. I appreciate
Really.
showing you all of the tricks of the trade.
I really enjoyed this. This is great. Thank you so much, Anna. Well, it's kind of nice to see the waiting room as you wait to come in and see you. All the way over here to the reception desk. Yes. And I love that aquarium.
It's very peaceful and relaxing while you're waiting for your dental appointment.
Right.
To be able to look at the aquarium and the fish swimming around. And we also have a complimentary Keurig coffee maker here, and you can make individual cups of coffee how you'd like, and we keep juice here and some snack bars.
Well, listen, this has been a great time together. I'm so glad you spent as much time as you did showing me everything that you do.
Thank you, John. It's been my pleasure.
All right. Thanks again.